Welcome, everyone. Thank you for being here. I'm Rebecca Chaplin with AARP, and today we're talking about Medicare Open Enrollment. And I get to be joined by a friendly colleague, Bruce Birdsall, Director of Medicare Services with the Council on Aging for Buncombe County. So, Bruce, why is Medicare enrollment important right now? Tell us why we need to care and learn more about Medicare Open Enrollment.
I'd be glad to. Thank you, Rebecca, and it's a pleasure to be here with you and everyone this morning. Medicare Open Enrollment is the time of year for all Medicare beneficiaries. You know, the way Medicare has been set up, you can't just enroll and change your plans anytime you want to. I mean, that might be nice, but unfortunately, that's not the way it works. And there are certain specified enrollment periods in which you can change your plan. And so all of us have to be aware of when they are so that we can take advantage of them when it's beneficial for us. So this current open enrollment, and it's also called the annual election. So if you hear that term, they're really synonymous. It's just started a little while ago. It runs from October 15th through December the 7th. And the key thing about it is this is the time when every Medicare beneficiary is eligible to change their plan. You can review your coverage. You can make any changes that you would like to. Any change you make during this time, it's effective January 1st of the following year. And so what happens is all the rate changes and changes in prices and copays and coinsurance for Medicare are published just before this open enrollment. So what's a great practice is for everybody to be informed of this information and do an analysis, review your plan so that you can see what looks good, what would be best for you for the coming year. In this case, 2023.
What sort of changes should a consumer look for? Say they've been enrolled in a plan in the past. What changes might be intriguing to people changing or renewing?
So one really important thing is everybody should have received prior to the open enrollment what's called an annual notice of change. And so whatever plan you currently have, you know, the drug plan or say a Medicare Advantage plan, will send you this information. And it details for the plan that you're in what's changing for the next year. And it could be, you know, the cost, the premiums, the cost of copays for drugs. If you're an Advantage plan, the cost of medical services, what providers are in the network that may have changed. You know, and that's a huge thing if you're on a Medicare Advantage plan. If I have a specialist, and let's say next year they've dropped out of the network of this plan, I have to really think about, do I need to change plans to keep seeing that specialist, or maybe I'll change specialists. So there can be some important healthcare ramifications when you get that annual notice of change. So that's the first step, is to just see where your plan is going. Then the next important step is to do an analysis of what coverage will work best for you. And this is the thing about Medicare that a lot of people don't really quite understand. There are so many options. Unfortunately, the way the system has developed, it's extremely complicated. And so if you can get the help of someone, some agency, to help understand what you want for your coverage and how that fits into what Medicare plans are going to be available in the future. So for instance, when, you know, choosing, let's say you have drug coverage, the one thing you don't want to do is choose your drug plan based on the premium.
Hmm.
And that's a very common thing that people think, oh, look at this one. It's only $7 a month. That's much better than the plan that's $48 a month.
Hmm.
That may not be the case, because in choosing a drug plan, you do it by how well does that plan cover the drugs that you are currently taking. So if I'm in a plan where my drugs aren't on the formulary, that's the list of drugs that a plan covers, I have to pay full retail cost. And I'll end up spending much, much more than the difference in the premium, perhaps, for the lower cost plan. So that's just an example of how getting help and doing an analysis can maximize your coverage and help you save money. And some of it's just not apparent, to people who aren't that familiar with the Medicare system.
Great point. So there's a lot to unpack there, Bruce. I guess the first question for me is, because it is complex, and identifying a guide that is not trying to sell you something, how can someone be sure that the person they're consulting is not biased in any way in terms of what plan?
Well, let me start off by talking specifically about the Council on Aging of Buncombe County. We are the coordinating site for the SHIP program.
Mm-hmm.
And SHIP stands for Seniors Health Insurance Information Program. It's sponsored by the North Carolina Department of Insurance. And so the goal of the program is to provide information, to provide education, help people understand Medicare, help people make the choices that are going to get them the best coverage, save them money. We are what you call unbiased. In other words, we're not promoting any one insurance company over the other. We're not promoting any particular plan over the other. We want to show you all the options to help you make the best decision. And whatever you choose doesn't affect us, in essence. Whereas, agents, insurance agents and brokers, they also provide, a lot of the same information.
Mm-hmm.
However, sometimes, and it only makes sense, right? They will tend to promote plans or programs in which companies they represent, or, perhaps where they're making a commission. So that's why a program like the SHIP program can be so valuable to people, because you can rest assured that we're looking at it from your best interest.
Mm-hmm. Mm-hmm.
There is no self-interest on our part in this kind of service.
So it's a free service
That is
to
correct.
Medicare beneficiaries to receive guidance and support in selecting the best plan for themselves. That's pretty awesome.
Exactly.
That's available.
You stated it perfectly. That's really the goal of what we do.
Wow. What an act of service. So I know you serve at the Council on Aging for Buncombe County. What is, and we'll talk both about the geographical area you cover and statewide, what people can do to get more information and find a SHIP coordinator. So starting with that first question, what is the geographical scope for the Council on Aging?
So we're the coordinating office for two counties, actually, Buncombe County and Henderson County.
Okay.
So both of those counties go through Council on Aging of Buncombe County. Every county in North Carolina has a SHIP program and a dedicated SHIP office and staff. And so if you're in a different part of North Carolina, you can access this information at the North Carolina Department of Insurance's website. And it's ncdoi.gov. You see it right there on the screen. And so anywhere you can be assured that you're getting the same unbiased service that's available to beneficiaries.
Okay, great. And what if someone wants to start doing some research on their own? You mentioned that the current Medicare beneficiary will get a notification of change before open enrollment from their current provider. But if someone's either starting from scratch or wants to do a little research on their own, where can they go to look at the plans and the coverage and the providers? How would someone do that research?
One thing we do at the Council on Aging, we kind of have a two-step program that we offer to people. And the first is we offer introduction to Medicare classes and webinars.
Cool.
And these, it's an hour and a half, maybe 2 hours, where we go through all the different parts of Medicare, how they work, who's eligible, how you enroll, when you enroll, the different parts, what the costs are, how you compare them, and things like that. That provides a really nice foundation for people. Then we also offer counseling services, one-on-one, where people can come in, meet with a trained counselor, and go over the details of their needs. It depends on your financial needs. It depends on your health condition. There are a lot of different factors so it's it's a customized service. It's not like you're picking something off the shelf. I want one and I'll take the lowest price. If you can get a plan that customizes and fits you, that's really optimizing your plan. Now, one of the tools we use is the Medicare.gov website. And this is the federal government's official Medicare website, so you can trust it very, very well. It has what's called a plan finder. It has a lot of information, but there's also a feature that's called the plan finder. And it will show you all the different plans that are available to you, and even depending on your physical location. And so you input certain things, like you can enter your drug list. Okay, what drugs I'm taking, what's the dosage, and so on. And it will calculate for you, what might be the lowest cost plan, including premiums and copays at the pharmacy for the following year. So
wow,
it's a great tool for Medicare Advantage plans, which combine medical and drug coverage in most cases. It will also show you a list of what that particular plan's copays or coinsurances are when you receive a medical service. So it kind of takes the mystery out of it. It's a great software, and it allows you to customize it to your specific situation. So we use this software when we counsel people, and everyone can access this and play around with it on their own, of course, as well.
So it's called Plan Finder. Is that
Plan
right?
Finder. Yeah.
Okay.
On the website, you look for, find health and drug plans and follow the links, and it's quite easy to get to.
Okay. Cool. So you use that tool, and an individual can do their own research using that tool, and then maybe take that to a counselor to have more conversation. That would be a good way for someone to prepare themselves. If you have questions while you're watching this, I mean, we have an expert right here. So, without getting too specific, any kind of general questions, you're welcome to type those into the comments section, and we can answer them in real time. So let's see, Bruce, we've talked a little bit about the role of a SHIP counselor, where to find one, why it's important to review your plans. I guess a question that has come up in people, like consumers I've talked with, is around the distinction between Medicare Advantage plans and other Medicare plans that one could seek. Can you just talk a little bit about the difference and the similarities between the two and what one should consider?
Sure, absolutely. It is one of the fundamental choices that a person on Medicare has to make. And there are two ways you can get your Medicare benefits. One is what's called original Medicare. It's also called sometimes traditional Medicare. And the other is the Medicare Advantage plan. And they're two very separate systems. The way the original Medicare works is you have Medicare Parts A and B, that's your medical and inpatient hospitalization. And then people look to buy what's called a supplement or a Medigap policy. And what that does, that's with a private insurance company. And that will cover some of the things that Medicare A and B, the federal part of the plan, don't cover. There's deductibles and coinsurances. So you have A and B, you get a supplement, and then you get a separate drug plan to cover your drugs. So that's the whole package under original Medicare. Since it has so many parts, you pay more premiums. Okay, you have to pay the Part B premium, which next year is going to be $164.90 a month. You have to pay for your supplement with the private insurance company and the drug plan. with a private insurance company. You'll pay more premiums, but you'll have very comprehensive coverage. You may have very little out-of-pocket coverage, out-of-pocket expenses. Also, you can go anywhere that Medicare goes. So whether you're in North Carolina, you're in California, you're in Alaska, doesn't matter. Any provider that takes Medicare, you are good to go. Your insurance is behind you 100%. The other option is the Medicare Advantage plans. And basically what happens there is Medicare contracts with private insurance companies, and they administer your benefits completely. So you can get Advantage plans that have both medical coverage and prescription drug coverage. So you have everything in one package. You put your Medicare card in your drawer and you just use your Medicare Advantage card when you're getting services or drugs. Now, it's similar to original Medicare in that you have to still have both parts A and B, but you just have the Advantage plan on top of that. And some are very low premium. Some have no premiums. And this is always an interesting thing for people because they say, oh, this is free. Well, it's free from a premium perspective. However, with Medicare Advantage, you have co-pays for every medical service or co-insurances. So you might have $25 at your primary care doctor, $50 at a specialist. You may have to pay a few $100s a day in the hospital for the first few days. So you pay less premium, but you pay as you go. And the other thing about Advantage plans is you have to use providers in the network to save the most, to get the best price. Some plans you can go out of network, but you pay more. Other plans you go out of network, you might pay 100%. So it's kind of like it's a trade-off. Advantage plans do provide some extra benefits, and that's what people see on the advertisements on TV, right? You can get some dental, vision, hearing, not covered under the original Medicare. So that's an advantage. However, these benefits tend to be very limited. They're not, in most cases, you might get preventative dental at a dentist in network, but you don't often get root canals and crowns and that kind of stuff. So it's not a right or wrong choice. I mean, currently, I think the figures are maybe 60% of people nationwide are on original Medicare and 40% are on Advantage plans. Advantage plans are increasing. They're being marketed very heavily. That's what you tend to see when you see the commercials on TV. They're usually promoting Advantage plans. And they're adding extra benefits to make them more enticing. So either one can work for you, but it's important to understand how each one works so you can see in advance what might work better for you before you actually enroll. And that's always the kind of the trick of what we do is, we get all the facts in advance, but of course, none of us know what's going to happen during the next year from a medical perspective, what drugs we're going to get prescribed. So, there's always a little bit of, I'd say, rolling the dice, so to speak, involved in making your choice. But as I say, have the foundation of the information, know how it works, see what the costs are, see what the potential costs are, see the pros and cons. And then you can make, the best decision based on the facts and information that you have available.
Wow, I know when friends, colleagues, community members turn 65 or they're going to be turning 65, they're very excited because they know that, for once there is something that is consistent, and I get there's a lot of variables, but at that age, someone is eligible for Medicare. So it's a very exciting time. Let's say someone turned 65 in the middle of 2023 in May. Would they be going through open enrollment now, or at what time in the year would they seek engagement there?
So if, let's say you turn 65 May 15th in 2023, just for an example, in that case, you're under what's called the initial enrollment period when you're first turning 65. And it's a 7-month window. And it's 3 months prior to your 65th birth month, the month of your 65th birthday, 3 months after. So when you enroll in that time period is important because it determines when your Medicare starts. So if my birthday is in May, 3 months before, that means February 1st, my initial enrollment period would start. So if I enroll in February, March, or April, my Medicare begins May the 1st. If I enroll in May, June, July, or August, my Medicare will begin the first day of the following month of my enrollment. And this is important because people, whatever coverage you have prior to Medicare, you want it to dovetail perfectly into your Medicare coverage. We don't want any gaps in coverage because that's dangerous. That's a lot of liability. We want to be covered seamlessly as we make the transition from whether it's employer coverage or the Affordable Care Act into Medicare.
Okay. So is a SHIP coordinator available to help someone mid-year or only during open enrollment time?
All year long.
Okay.
This is a program that runs throughout the year. Of course, during this time, there's a huge volume of people seeking our services because everybody on Medicare should be reviewing their program during this time. Even if you don't make a change, fine. You're not obligated to make a change. But you need to be aware that the best program for you this year, 2022, may not be the best program for you next year.
And if someone does nothing and they are currently enrolled, will that automatically re-enroll them in the same program?
Yeah, as long as if you keep paying your premiums, if you don't make a change, you stay in that program. I mean, the only thing to be aware of is perhaps say a particular Advantage plan was ending, was no longer being available. Then you have to make a new selection. But you should be notified that, of course, by your provider.
Okay. So today we hoped to give people a start, like a public service announcement for what a person can do to be empowered and making good choices about their Medicare selection. AARP's mission statement is to empower people to choose how they live as they age. And certainly with Medicare, it's important to make an informed decision. And I know along with other aging service providers, AARP is a strong advocate for the sustainability of Medicare because it's a really important part of aging well. I'm so grateful for the work at the Council on Aging and other SHIP agencies across the state of North Carolina and across the nation. As a little recap, this was a start. If you learned something today, please share this video. It will live in perpetuity on Facebook pages where you saw it or YouTube channel. So please do share it to help others gain knowledge. As a step 2, Bruce, you mentioned that people could take an online class if they wanted to learn a little bit more. Would they find out more about that at the Council on Aging's website?
Yes, if you go to www.coabc.org, we always have a current list of schedule of both the webinars and also the in-person classes that we do around the county locally.
Cool. If you don't live in Buncombe or Henderson County, can you still take advantage of the online courses?
Absolutely, especially like during the pandemic when that's all we were doing. We were getting people from Maine to California who were just somehow finding out about it and signing up. I mean, that's the beauty of the online things. We're not limited by the physical space.
That's right. So we can all benefit from the great work of the Council on Aging in Buncombe County, but also other SHIP coordinators and SHIP programs across the state. I'm sure there's many great examples that are, on the parallel path, and folks can find out more through the North Carolina Department of Insurance.
Absolutely.
As
And can
reflected
I
there.
just give everybody our phone number as well in case they wanted to contact us? So besides the website, our phone, 828-277-8288. You're always welcome to call us there and ask a question, make an appointment. We always say in the Medicare world, there is no question that is too small.
Yeah, it's complex. There's a lot of questions. We just planned on 3 questions today, and I came out with about 10. And as we started to talk, because it's that one question opens up into another. So please do contact the Council on Aging of Buncombe County if you live in Buncombe or Henderson counties. And if you don't, check out the North Carolina Department of Insurance. As a reminder, open enrollment started October 15th and goes through December 7th. Anything else, Bruce, that you want to leave our viewers with today?
Just thank you for listening to this program. Thank you, Rebecca, for having the opportunity to present this information to people. Because the costs of healthcare has really skyrocketed over the years. And a lot of older adults are on fixed incomes. So the Medicare part of their lives can have a big impact on the quality of their life. And that's why we're so dedicated to providing this service and, really feel that it's very important for everyone. So to get this information out, we're very thankful to you and AARP. So thanks a lot.
It's our pleasure. And with that, we hope you'll share the video on your social media, those of you watching today, so that others can benefit from this baseline knowledge and take it from there. So thank you, Bruce. Thank you, Council on Aging. And we'll say goodbye to our viewers for now.